All right, guys. So this is going to be an introduction to the community assessment presentation of Diana and I's project. It's the assessment of presentation on Paterson, New Jersey. Our objectives are going to be a historical overview, then asset mapping. Within asset mapping, we're going to talk about the structure of the community, population of the community, health-related resources, environment, economic development. Then we're going to move on to community needs. And then after community needs, we'll talk more about the impact of the boundaries of the community. So beginning with the history of Paterson. In the year 1792, there was a man named Alexander Hamilton, who we all know. And he's created an investment alliance called the Society of Useful Manufacturers, also known as the SUM, S-U-M, in which the funds would be used to develop an industrial city in the United States. This city would later become known as Paterson. Hamilton believed that the United States needed to include industrial manufacturing in addition to its agricultural production. The industries established in Paterson were powered by the Great Falls of Passaic County and a system of water raceways that were harnessed by the power of the falls. Textile industries became the most prominent source of city revenue, and later the firearms, silk, and railroad locomotive manufacturing industries were added. Later on, in the 1800s, silk production became the dominant industry and formed the basis of Paterson's most prosperous period, earning it the nickname Silk City. Well, during those prosperous periods, there was also a high demand and equality in the labor workforce, so the workers ended up creating a strike. In 1913, they stopped working and started demanding for 8-hour days and improved working conditions. There was also an anti-child labor legislation they were pushing for, and more safety in the workplace. They wanted a minimum wage on top of that. The strike lasted for 5 months, and during those 5 months, many workers were arrested. Along with the strike, the industry was being damaged. There were bordering towns, cities that had the same silk companies that were all competing against each other. And during the strike, they actually helped the other companies advancements and technological systems to create silk. And Paterson was just really negatively affected by all this, and eventually silk was driven elsewhere, and thus Paterson lost it.
Okay, so Mike has talked about the history of Paterson, which it's a very rich history. Now I'm going to start talking about how we looked at the major features of Paterson to do our community assessment. So we looked at the aggregate of people, the location in time and space, and the social system of Paterson. So first I'm going to start with the aggregate of people, which is the who. So that's personal characteristics and risks of Paterson. So I want to start by talking about housing in Paterson. There's a lot of housing options. There's owned housing and there's rented housing. Also, though, while we were going through Paterson during our windshield survey, we saw a lot of houses that were foreclosed or owned by banks. Some of the houses, though, were seemingly in the process of becoming reconstructed, which is great. Hopefully, some of the houses will be inhabited by the population within the next few years or so. Who knows? But it's good to see that there's some work being done towards fixing these old houses that were, taken over, abandoned, and whatnot. So the different kind of housing assistance that's found in Paterson is temporary assistance for needy families. The transforming rental assistance program, Section 8 housing, is also available. There is homeless shelters available as well, halfway houses, and group homes. Next, we're going to talk about religion. So Paterson is a very diverse area in New Jersey, like the rest of New Jersey is, but Paterson especially. Some of the religions that are prominent in Paterson can be seen just by driving around. There are mosques, there's synagogues, and churches, Catholic churches, Christian churches, and whatnot. Next, I'm going to talk about the demographics, race, and ethnicity of Paterson. So you can see that I have a breakdown of the ages of people and how they make up the population. So 5 years of age and under make up 8% of the population. 18 years of age and under make up 18.7% of the population. 18 to 64 years of age make up 63.1% of the population. And our elderly people over 65 years of age make up 10.2% of the population. Hispanics make up the majority of Paterson's population. That's 60.3%. 26.2% of the population is Black people. 8.6% are white people. 3.7% are Asian, and multiracial ethnicity makes up 0.9% of the population there. The most common country of origin, so people that have left their countries to come to live in Paterson, are mostly from Dominican Republic, Peru, and Mexico. So next I'm going to get into health and risk factors that can lead to poor health for the people of Paterson. So risk factors include drugs, alcoholism, substance abuse. The current opioid crisis that New Jersey is having is like a huge issue. Gangs, ICE, overall violence in the area, prostitution, poverty, low socioeconomic status persons, pollution, overcrowding in certain areas, language barriers, corruption, liquor accessibility, and that goes back into, the abuse of substances. Domestic violence, as we heard in Oasis, there's definitely outreach there to help stabilize and provide support for victims of domestic violence, and there's other organizations available as well. And there's also a lack of health care literacy prominent in Paterson, and that's mainly due to the language barriers. So prevalent health issues in Paterson that come from those risk factors is HIV, lung diseases like tuberculosis. There's actually a tuberculosis clinic that's available. Addiction is a problem. As I mentioned, that could be alcohol, prescription drugs, addiction problem. The methadone clinics may be seen as a health problem as well. There's some controversy over that. Also, there's a lack of nutrition in Paterson, and there are organizations trying to combat that. But there's definitely, driving through Paterson, we saw a lot of accessibility for fast food. I don't think he liked us filming.
Sick.
Our new Dunkin'. We got a food truck right here. But it's affordable, so like I said, there's organizations trying to be available so people can get fresh produce, healthier choices, and whatnot. STDs are an issue in Paterson as well, and that ties into the risk factor of prostitution. Just say no. As well as education, things like that we'll get into later. But cardiovascular disease is also prominent in Paterson, and that could be partly due to lack of exercise, as we all know, smoking. So just like in Paterson, alcohol abuse, liquor is an issue, and like liquor stores are available on every street corner. I mean, really, there's no place in no street, unless, maybe in more residential areas, there's always liquor accessibility, liquor stores, bars also. But there's also cigarettes available. So there's bodegas that sell them, and that's part of the part of the issue in cardiovascular disease. Of course, smoking is never healthy. And also combined with the lack of exercise, the accessibility of fast food, cardiovascular disease is definitely an issue. Next, we're going to talk about diabetes and the management of it. So, the diabetic patients in Paterson may not understand the importance of their drug regimen or understand their actual drug regimen and what they need to do to help keep their glucose levels within normal limits. So diabetes and the management of diabetes is another health issue. Medication noncompliance is an issue in Paterson that is related to perhaps polypharmacy, health literacy issues again, which could, stem from the language barriers. People not fully understanding what prescriptions they need to pick up and when they need to pick them up and how to properly prescribe their medication, use their medications. Another issue in Paterson that we wanted to mention was teen pregnancy as well. So now getting into Paterson's location and time and space, like I said, that was another method that we used to highlight the major features of Paterson to do our community assessment. So that's the where and when. It's a physical location frequently delineated by boundaries and influenced by the passage of time. Paterson is filled with history. You can see it just driving around, especially in a certain area that I'll get into. So we're going to talk about the neighborhoods of Paterson. We have a lot listed. I didn't even know that there was this many labeled neighborhoods, but there are. So I'm going to talk about just a couple of them briefly. Downtown Paterson is the main commercial area. We have that filmed in our windshield survey. You can see it's a much more congested area. There's plenty of shopping. We saw a lot of transportation in those areas too. So buses going up and down the street. It's also not too far from the train station either. So you can also be in that area and then go to the city or anywhere else in New Jersey through NJ Transit, bus or train. Also Stony Road in Paterson. That's the most southwest neighborhood, and it's bordered with Woodland Park, which used to be known as West Paterson. To the south of that area is Totowa, and across the Passaic River Totowa is found across the Passaic River to the west. Wrigley Park was also called Fourth Ward. It's a neighborhood located north of Broadway in Paterson. The neighborhood has experienced years of poverty. That's actually, like I mentioned, some of the houses that were getting looks like they were becoming reconstructed. That would be in that area. It's definitely more of a rundown area. We noticed that just by driving through. So like I said, years of poverty, crime, and overall neglect, but hopefully from what we saw, that might be changing, which is great. And I definitely want to touch on the old historic district, the old great historic district, sorry. So this is the Falls area, the Paterson Falls, which we know, talking about when we talked about it in the history overview, is the part that really was like the powerhouse of Paterson and part of its major development for why people settled there in the first place, for the factories, the silk factories and everything. So this is definitely an area that we can really see the history of Paterson. Just going through it, you can feel the history. And we even we actually left the car and walked around that area a bit near the falls, and they're breathtaking. They're huge. The water is flowing so fast, and we also went down one of the paths, and you could see that there was tons of old factories lined up right along the river over there. So you can still see the historic aspects of Paterson just by walking through it today, especially in this area. I'm not going to list all of the different neighborhoods out loud, but you can see them in the slide. So Paterson could be considered urban living. So as for outdoor recreational space, there definitely is green space in Paterson that people can readily use. There's the Paterson Great Historical Park, East Side Park, a skate park is available, West Side Park, Roberto Clemente Park, Garrett Mountain Reservation, which no matter where you are in Paterson, you can really see all the mountains around you, which is kind of cool. You're in especially when you're in a congested city with a lot of people, a lot of traffic, it's nice to be able to look around and see the beautiful mountains. Wrigley Park also offers green space, and Veterans Park, which is a memorial to veterans, and there's green space around there too. As for indoor recreation, Paterson has a YMCA. They have gyms like Planet Fitness. There's the Boys and Girls Club of Paterson as well. Rock and Roll for some arcade games. Shopping centers mostly found in downtown Paterson for people to go in and out of. Next, we're going to talk I really want to talk back about the old district of Paterson, where all the factories are. So one area in that old district that we really wanted to highlight and talk about is the art factory, which is really cool. I haven't looked too much into it before this project, but I had heard about it. And now that I've looked more into it, I'm super interested. So we're going to watch a brief clip kind of describing it.
The art factory.
You just walk through it, you just go, oh, this is awesome. Anything you want to build, you can do it here.
For cabinet maker Bill Cates, the art factory is like a home.
Very good character, beautiful woodwork.
In the next room, metal worker Scott Usher of Teaneck is constructing LED lighting for elevators.
We've got machine lathes and vertical milling machines and grinders. It's a regular hive of industry.
The art factory's 400,000 square feet easily accommodate industrial arts, film production, gallery exhibitions, and a wide range of events. Artist Matt Gosser teaches architectural design at NJIT and has a studio in the art factory. He takes advantage of the 25-foot-high ceilings in mounting an art exhibition on the 4th floor called The Big Show.
From the inside. It's large sculptures, it's large installation, it's large paintings.
Most of the artworks in this huge gallery are made out of found and recycled objects.
This piece is called Daddy Longlegs by an artist, Peter Whitney. He made this out of crutches. This is a piece by Matt Nicolosi. He used recycle pallets.
Matt Gosser's own work is entitled Textile Wheels and recalls the factory's early history of using renewable energy by diverting water from the Great Falls.
There was a large water wheel that was powered by the canal system here in Paterson. Water would turn a big wheel, generating this axial power that all other textile machines would spin off of. Everything was working off of this radial power from the Great Falls.
Matt sees large-scale building renovations like the art factory as a logical redevelopment strategy for cities in New Jersey and beyond.
So now I'm going to talk about Paterson and its neighbors, its boundary towns. So there's Clifton nearby, Haledon, Hawthorne, Prospect Park, Totowa, Woodland Park, like I mentioned before, Elmwood Park, and Fairlawn. So we picked two of the boundary towns to briefly talk about. As you can see, we have a comparison of Paterson to Fairlawn. And on our next slide, we have a comparison of Paterson to Hawthorne. So Fairlawn is Bergen County. Hawthorne is Passaic County, like Paterson is. So we can take a look at that to see some of the differences, which some of them are pretty clear. Now I want to just touch on Passaic County as a whole, which is the county that Paterson is in. So Paterson along with every other town in Passaic County, has a shared Department of Health. Tax money is shared as well. For kids who are of school age kids, they don't have to go to school in Paterson. There are private schools that they could attend in other towns. And as for recreation, there are countywide recreational activities for people to enjoy. So next, we have the side-by-side of Paterson, New Jersey versus New Jersey as a whole. This is another quick view to compare Paterson and the rest of New Jersey that we could all take a look at. And that pretty much sums up the location of Paterson. So now we're going to talk about Paterson's social system, which can be broken down into the why and the how. So it's described as the interrelationship of the who, like we talked about first. So now this is taking everything we've talked about so far and kind of combining it together to better understand the city of Paterson. So as for services and health problems, which is a very prominent thing in Paterson, there's the Straight and Narrow organization, the Hyacinth AIDS Foundation, St. Joseph's Regional Medical Center, which is huge. They even have their mobile units in Paterson as well. Oasis, like we visited, Kumac for the fresh produce and such, Eva's Village, which takes up blocks of space, but super needed. They have a homeless shelter, they have a little cafeteria area, housing, and it's a huge part of Paterson, I believe. And during our windshield survey, it was really interesting to point out all of the buildings that Eva's Village has. Also the apartments that they have, there's brand new apartments being built. So once the people who use Eva's get to their final step and they start to seek out their own apartments, Eva's offers apartments. So it's really cool driving past them. Habitat for Humanity is also a prominent organization in Paterson. Paterson also has the syringe program in place right now to help prevent the spread of diseases like AIDS or HIV. There's the Well of Hope in Paterson, and then as for assistance, there's SNAP, there's WIC, there's child protection agencies that can be called and are used in Paterson. There's the PATH program, there's the methadone clinic, which again I said is controversial. It could be seen also as like a health issue, but the methadone clinic does overall have a goal of trying to help in addiction. Immunization clinics are also readily available. Health education classes are offered in English and in Spanish, so people to help kind of diminish those language barriers and to help promote health literacy. And there's also the TB chest clinic, as I talked about before, that's available certain days of the week and at certain times. So why do we need these programs? Why do we need all these services in Paterson, New Jersey? So the city of Paterson is trying to combat the spread of disease, the incidences of domestic violence, substance abuse problems, homelessness, mental illness, nutritional needs, and the overall safety of the community as a whole by providing these services. There's people in need, and there's an overall goal for the city to help improve their health, fight against poverty, strengthen individuals and their families, and provide ongoing support. So these organizations and the city itself do a lot to try to bring up the people in the community. Again, as I mentioned, there's a lot of issues that are prominent in Paterson. So these organizations and any funding, donations, grants, such are really, really important. So some of the funding comes from VOCA grants, which are victims of crime assistance. There's a veterans grant, which is the HUD-VASH. There's the SAMHSA grants, which is for substance abuse and mental health. programs. And again, like I mentioned, private donations are huge, and Passaic County taxes also go towards some of these things for the community. So we have some articles that we found, current events that are recent in Paterson news. So one thing was that the Paterson schools are facing a budget shortfall, which could definitely affect the youth of Paterson. So you can quickly take a look at that. And next, we want to touch on Paterson possibly laying off 112 police officers, which definitely puts the community at risk for more safety concerns, drug problems. So that would definitely be a downfall or defeat in the community. We definitely need police officers patrolling, enforcing drug laws, and combating violence and whatnot. So again, this is another piece of the article that we read. You can take a look at.
Okay, guys, how you doing? So, Diana left off on the project, and the last she spoke about was about the articles on the budgetings in Paterson. And she spoke about how the schools were getting cutbacks, and she also mentioned about the Paterson police officers beginning to get laid off. So now this is the ending of our video, and I'm going to talk about some community needs. So our community diagnosis is going to be of increased risk of addiction among the Paterson population, related to the accessibility of drugs and alcohol as demonstrated by the presence of numerous liquor stores, bars, indications of drug deals, and the documented rates of drug and alcohol addiction in the area. Our interventions in combating this would be to work with the city of Paterson to implement a citywide agreement that limits the number of liquor stores for one liquor store in a radius of 1.5 miles. We're also going to work with the city of Paterson to implement a citywide agreement that mandates liquor stores to be individual establishments and therefore not combined with any other sales, such as pharmacies. You might think that's ludicrous, but we actually have a clip of a pharmacy that is combined with a liquor store. It's called Florida Drug and Liquors. I'm not trying to shame any company, but that is kind of like something hard to understand. Like, how can you go to your pharmacy and pick up your Xanax and then get a beer on the way out? You know, it doesn't make sense, especially to us health professionals. Next thing we're going to implement is encourage people of the city of Paterson to work with law enforcement in reporting suspicious activity in their neighborhood. We're also going to follow in the footsteps of some European countries like the Netherlands, as well as some cities like Seattle in the US, to combat the opioid crisis that is present in Paterson and the rest of New Jersey. And what they do is something kind of unique. They actually create these safe injection site zones where it gives the user a peace of mind on where they can shoot their heroin or use their drug of choice in peace of mind and under watchful eyes so that they don't overdose. And essentially, by the end of that, they're also given plans for treatment, recommendations to get help, and create a solution plan whenever they're ready to start receiving that sort of help so they can become sober. That's interesting. And our next community diagnosis is increased risk of sexually transmitted diseases among Paterson population. Related to the amount of prostitution, HIV epidemic, and low socioeconomic status, demonstrated by the Windshield Survey, the ongoing need and use of Hyacinth AIDS Foundation, and the need and use of STD testing and treatment facilities. Interventions for that, we're going to encourage the community to continue to advocate against prostitution, spread awareness, and end prostitution through signs and awareness of risks. We're going to give free condoms at all health-related centers and educate through discussion groups, billboards, and media about how to prevent STDs, where to get tested for STDs, and the importance of treating the STDs. So those are interventions. And yeah. Alright guys, so this is the last community diagnosis we're going to talk about. And so this one is going to consist of this community diagnosis is going to consist of increased risk of homelessness among the Paterson population related to socioeconomic factors demonstrated by the need for homeless shelters, the abundance of foreclosed homes, and windshield survey. Interventions in combating the homelessness. We're going to increase funds for organizations such as EVA's, OASIS, and QMAC to help combat homelessness by bringing attention to the need for monetary donations through media, billboards, and posters. We're going to connect with the homeless population to provide support, guidance, and identify individual needs for rehabilitation. So thereby connect him or her with an organization that will be the most beneficial for that individual. Then we're going to ensure that youth and young adults are made aware of the importance of finishing high school, furthering his or her education in order to become financially independent by holding community discussions and promoting ongoing education in schools and other community settings to prevent homelessness.